All right, today we're diving into a medication that was an absolute game changer for patient care. It's a drug that takes on one of the most miserable side effects of some really powerful medical treatments. We are talking about Ondansetron.
I mean, just think about that for a second. What if that awful, debilitating nausea you get from chemotherapy or after a huge surgery, what if you could just switch it off? That's the incredible idea behind the science we're about to get into.
So here's our game plan. We'll kick things off with why this drug was even needed, then we'll get into the nitty-gritty of how it works. We'll look at its main jobs, cover the common side effects, and the really serious ones before we wrap it all up with the big picture. Sound good? Let's go.
Okay, first up, let's really set the scene here. Because to get why Ondansetron was such a big deal, you have to understand what the world was like before it came along. For decades, this was just a brutal, accepted fact of cancer treatment. The very thing that was meant to save your life made you feel profoundly, horribly sick. So sick, in fact, that it could actually make people want to stop their treatments. It was just a massive blow to their quality of life.
And then this came along. And look, Ondansetron wasn't just another pill to try. It was different. It was incredibly targeted. It completely changed the game, giving patients real relief and making it possible for them to actually tolerate their life-saving treatments.
So what's the secret? How does this thing actually pull it off? How does it so effectively shut down that urge to be sick? Well, let's get into the science of it and see how it cleverly jams the body's own sickness signals.
Okay, think of it like a domino effect in your body. First, a trigger, like chemo, causes this huge flood of a chemical called serotonin down in your gut. Step 2, that serotonin grabs onto a major nerve, the vagus nerve, and sends a super clear message up to your brain that basically screams, "We are sick." And finally, step 3, your brain gets that message and triggers the feeling of nausea. Now, the absolute key to this entire process is something called the 5-HT3 receptor. The best way to picture it is as a very specific docking port on that nerve. For the sickness signal to get through, serotonin has to connect perfectly right there. If it can't dock, the message goes nowhere.
And this is where Ondansetron does its brilliant work. It is, quite literally, a signal jammer. The drug molecules race to those docking ports and they just park there. They take up all the spots. So when that big flood of serotonin shows up, there's nowhere for it to land. The signal gets stopped right at the source, and your brain never even gets the memo to feel sick. Pretty clever, right?
Okay, so we know how it works. Now, where do we actually use this powerful tool? Let's take a look at its main missions out in the medical field.
This table shows us something really important, the difference between approved uses and what we call off-label uses. So on the left, you see what regulators have officially given it the green light for: nausea from chemo, radiation, and surgery. But on the right, you see doctors using their clinical judgment to prescribe it for things like severe morning sickness or a nasty stomach flu. It's not officially approved for those, but it's very common.
Another reason it's so widely used is its incredible versatility. You can get it as a regular pill, a tablet that just dissolves on your tongue, which is perfect if you already feel sick, a liquid for kids or people who can't swallow pills, or you can get it injected right into a vein for an immediate powerful effect in the hospital. That flexibility is a huge plus.
But of course, there's no such thing as a free lunch in medicine. Every effective drug has a flip side. So let's talk about the more common and usually pretty manageable side effects you might see with Ondansetron. So the big one, by far the most reported side effect, is headache. And because the drug can kind of slow things down in your gut, constipation is also really common. Other things like feeling drowsy or a bit dizzy can happen too. But for most people, these are totally manageable and a pretty small price to pay for relief from really bad nausea. All right, now we have to shift gears and talk about the more serious stuff. These are things that are rare, but they're absolutely critical for doctors and patients to know about.
So here are the two big ones. On the left, we have QT prolongation. The simple way to think about it is that it messes with your heart's electrical timing, which can be dangerous. And on the right, there's serotonin syndrome. That's a serious reaction you can get from having way too much serotonin in your system, which can happen if you take Ondansetron with other drugs like certain antidepressants.
And because of that heart risk, there is a very, very specific warning from regulators. A single dose given through an IV should never be more than 16 milligrams. That is a hard limit designed to keep patients safe from that heart rhythm problem.
This also means doctors have to be incredibly careful about what other medications a person is taking.
You can't mix it with other drugs that also affect the heart's rhythm, or that also boost serotonin levels. And there's one combination, with a Parkinson's drug called apomorphine, that is an absolute no-go. It's completely contraindicated because it can cause a massive, dangerous drop in blood pressure.
So, when you put it all together, the amazing benefits and these serious, though rare, risks, what's the bottom line? Well, it really all comes down to a modern medical balancing act.
You know, I think this quote from the research really just nails it. Ondansetron truly revolutionized care. It didn't just help with a symptom, it fundamentally changed a patient's entire experience, allowing them to get through some of the toughest treatments imaginable. Its impact has just been enormous.
And that leaves us with this central question, really, of all of modern medicine. The story of Ondansetron is the perfect example of this constant trade-off, this balancing act between incredible, life-changing benefits and real potential risks. It's a calculation that doctors and patients are making every single day, and it just shows you how far we've come.